Hi, I am Bibusha and I am a part of the team working on a project that can help people overcome alcohol consumption rates and addiction. So the health issue addressed in this health promotion program is going to be alcohol, and in the age group of 16 to 25 years. Reach Out Australia 2020 describes alcoholism as an addiction, urge and physical dependency on alcohol. There are changes that happen in the brain of someone who drinks a lot of alcohol, which makes them have physical withdrawals if they don't drink. The age group that is 16 to 25 years that have been targeted in this health promotion program are the young adults who are, according to David Knighton and Lowe 2009, the most vulnerable towards alcoholism. They justify the fact that 18 years of age mark the dividing line between services for children and adults, which makes it difficult to implement any kinds of health promotion programs. Jones 2005 describes this age group as individuals who separate from their parents and families to start a new and independent life, which changes their social networks, resulting in increase in their drinking behaviors. The health promotion aims to provide a useful framework for conceptualizing and implementing actions to reduce drinking, to decline the alcohol-related problems in people in the targeted age group of 16 to 25 years. The health promotion program will aim to provide skills and capabilities of individuals to take action against alcoholic behaviors by educating them and involving their communities to help reduce any alcohol-related risks. The main strategy of this health promotion program is to provide appropriate support and information on prevention of overconsumption of alcohol through online website, SMS service, helping people connect to health professionals, and community outreach programs. The first objective of this program is providing information on prevention and control of alcoholic behaviors from a website, where they will be able to get required information followed by a survey which will help the promoters to assist them to respective groups to take part in the seminars, which is objective number 2. The interested people who have been attracted by the website and really want to change their way of life will be requested to address to the seminars along with other individuals who find each other relatable. Which will be hosted by professionals and also community members of the society so that they can bond with each other, making them feel comfortable. The third objective is community outreach through sporting programs. The individuals interested in sports and physical activities are encouraged to take part and train with other individuals so that good quality time is spent rather than alcohol consumption. This program focuses on providing its service online from the website so that people do not miss out on the opportunities to better themselves. As Leon et al. 2009 found that one of the main reasons alcohol prevention programs fail is because 19 to 28% cancel or miss their appointments. Another reason for this program to be mostly online and focusing on educational and physical activity approach is that Leon et al. 2019 also found that medical approach did not work as effectively because 6 to 20% of patients would not redeem their prescriptions. So the purpose of this reflective log is to successfully work together as a group to come with a health promotion program to help individuals of 16 to 25 age group with alcohol consumption problems. The program is responsible for coming up with strategic objectives which will help in increasing success rates of the program, and also explain the planning model used in the program and analyze any ethical concerns that may arise in planning and implementation of this health promotion. The program has been developed based on health belief model. The information included in this part come from Bardsley and Beckman 1998. So the first construct of health belief model is perceived susceptibility. This refers to the subjective belief that a person has with respect to acquiring a disease or reaching a harmful state because of indulging in a particular behavior. So alcohol consumption is going to be the behavior which may result in acquiring diseases like cardiovascular disease or liver damage, weakened immune system, depression, and anxiety. The second construct of this model is perceived severity, which refers to a person's subjective belief in the extent of harm that can result from the disease or harmful state resulting in a particular behavior. So the alcohol may result in temporary and permanent condition which may result in death of an individual. If you look at it from a broader perspective, Behaviors also have the alcoholic behaviors also have effect on their family, job, and relationships. The third construct is perceived beliefs, which refers to belief in the advantage of the methods suggested for reducing the risk of the disease or harmful state resulting from the particular behavior. The rate of alcohol consumption is believed to reduce its risk only if an individual believes that alcohol has done enough harm to his or her life, so changes need to be made to reduce consumption. The fourth construct, which goes hand in hand with the construct of perceived beliefs, is perceived barriers. Perceived barriers refer to beliefs concerning the actual and imagined costs of following the new behavior. An individual may believe that online education program to be most cost efficient and may be interested as medical approaches are found to be expensive, inconvenient, unpleasant, or even upsetting. The fifth construct in health belief model is cues to action, which are precipitating forces that makes a person feel the need to take action. These cues may be internal, example perception of a bodily state, or external, example interpersonal interactions from online website, like the one in this program, interaction with professionals in seminars, receiving texts and online messages. The final construct is the confidence that a person has in his or her ability to pursue a behavior. Reducing alcoholic behavior is totally up to the individual according to this construct, but this program also focuses on providing appropriate information and opportunities so that it is easier to approach to relevant professionals to increase confidence in order to reduce alcohol consumption. All these constructs of health belief model has helped the team to develop the program, as each and every constructs, as discussed earlier, have connection with alcohol consumption and how these constructs are related to helping an individual to reduce consumption of alcohol. As these constructs have been discussed, alcohol is the harmful substance resulting in decline of quality of life of individuals, and it has to be the individual realizing that it has done enough harm to their life so that they can connect to health promotion programs like ours. Keeping in mind these constructs, this project team came up with suitable and modern objectives. That is, number 1, online website, SMS tool and survey. Number 2, seminars. And number 3, community outreach programs and involvement in sports. Strategies that the team came up with are to start off as an online service and gradually getting people involved in educational programs. And the ones interested in sports are involved in midnight basketball matches or encouraging them to join community health centers. Before the process of developing the strategies and objectives, everyone did their own research, and only after that we met on a Zoom meeting to pitch our ideas and come up with the 3 objectives and strategies for this project. There are ethical issues that arise with these kinds of health promotion programs. Bayer and Moreno 1986 believe that there are people who question if other people, except the individuals themselves, have the right to initiate these kinds of programs, as there are people who have the fear of losing their personal autonomy. Gutman 2017 also highlights that these kinds of health promotion programs can have effect on cultural aspects of society when changing their lifestyle or turning health into value. Drinking alcohol may have cultural importance and beliefs in certain groups, and when drinking is called unhealthy, interventions can have repercussions in these settings. For example, if the community where an individual is raised in has cultural aspects of drinking alcohol, the members of the community may not agree with that type of program. So getting the community members on board is also very important, which is why, to reduce the impact of this ethical issue, community members have been included in this objective, which is number 2, the seminar. The part of this my part in this project team was to get information about alcohol reduction to community, which is the 3rd objective. Inspired by an ongoing program called Midnight Basketball, it started as in response to question what's there for a young person to do on a Friday or a Saturday night. This national charity is making play basketball as an option in the communities they're running, in which they're running the tournaments in. So for this program, through the survey, people can be asked if they have any interest in any kinds of sports, so that they can be linked to the nearest and most convenient sporting centers, and so that they can spend their time, especially the Fridays and Saturday nights, where it is found that most people consume alcohol from parties and everything. Thompson et al. 2018 believed that physical activity may offer an alternative or adjunct approach to reducing rates of alcohol, as it is easily accessible and is potentially cost effective. Through psychological, behavioral, and physiological mechanisms, physical activity may offer benefits in the prevention, reduction, and treatment of alcohol and substance use across the lifespan. The main obstruction in planning this health promotion was being able to meet with the group in person, as everyone is social distancing. If we had an opportunity to meet up and discuss in person, I feel like it would have been more productive than through Zoom meetings. One of my strengths in this project is my research ability and working as a part of a team. I do not have the best communication skills, and I was not able to share my ideas with the group as soon as the project started. But gradually I overcame over that, and once comfortable, I have put my ideas forward to other team members. I am a shy person, and I need more time to become more vocal when working with new groups. But I have been working on that to boost, so that I can boost my self-confidence. These reasons have affected me in many ways in the past as well, which is why I have been trying my best to increase my communication skills and become more vocal. I have been trying to overcome this by doing as much research as possible before I go into Zoom meetings, so that I can have enough ideas to share with the group. I have also been following YouTube tutorials that help people overcome their shyness and become verbal on their opinions.